Hello, and thanks for coming to my video again. This week I wanted to briefly talk about assessments. I think assessments are so crucial in social work, whether you're working with clients, you're working with program development, and even assessments with internal employees. So specifically, I wanted to talk about some of the assessments that I work with at Mindula Health, which is the organization that I'm doing my field placement at. So one of my roles at Mindula is to go onto a behavioral health unit, basically the psychiatric hospital, and there I meet with clients who are admitted, and I perform an assessment with them. And I have one of my copies here to my left, just to help me with guiding. So there's three parts to the assessment. The first one that I do is called the Accountable Health Communities Core Health-Related Social Needs Screening. And that basically was designed to identify the burden and connect individuals to resources in their communities and address those needs to improve their health. So under that assessment, there's about 5 different questions. It starts off mentioning, asking the individual if they have housing. So the answers to that could be, I have housing, but I'm worried that I will be losing housing shortly, or I don't have housing. From there, I usually branch off and ask questions. For example, the next one, think about the place you live. Do you have any problems with the following? And then it lists mold infestation, lead paint, water leaks, oven or stove not working. So it's basically us trying to get a better understanding of their needs and how once they're enrolled in our organization or our program, we can better serve them. So then moving on, looks like next we would ask about food insecurities. So then it comes to the question I usually ask them, in the past year, have they had any difficulty getting food? Have they ever been worried that food that they've bought won't last enough until they have enough money to buy more? The next one I ask about transportation. Ask them if they drive, if someone drives them, or do they take public transportation? That's important because oftentimes once a client is discharged from the unit, they have different appointments set up, whether it's psychiatry, therapy, if they're involved in substance abuse, oftentimes they have substance abuse appointments they have to go to. So I want to gauge to as far as what their transportation barriers may be and how we can overcome them. So then next it asks once again about utility. In the past 12 months, have any utilities been shut off? Moving forward, it then asks about interpersonal safety. So there's 4 questions there. They start off saying, does anyone, including family, anyone physically hurt you? And then they move to, does anyone like scream at you or curse at you or insult or talk down to you? Some of the answers to that can be never, rarely, sometimes, fairly often, or frequently. And I mean, sometimes some of these questions can get a different response from clients. Some of them, will answer without thinking twice. Some of them seem to get a little bit uncomfortable with the question. So during the assessment, it's very important to gauge the client, how they're feeling when you're asking them questions, and answer any questions that they may have. So then the last part of the assessment is the M3, and this says the M3 screen is a mental health assessment desired to uncover the likelihood that someone has depression, anxiety, bipolar, or PTSD disorders. So it's broken up into 3 sections. The first part deals with the last 2 weeks, how they've been feeling. So it says, over the last 2 weeks, have you noticed any of the following? And then there's about 12 different questions. I can read some of them. Some, for example, I feel sad, down in the dumps, or unhappy. And the scores would be rank it 1 through 5. 1 is not at all, so low, up into 5, which is most of the time, so high. Another question would be, I've had thoughts of suicide. I have difficulty sleeping. We like to gauge their appetite, so there's a couple questions on if they're eating more or less than normal. That continues for 2 pages. And then at the end of the assessment, the questions switch a little bit. It's still ranking 1 through 5 with the same score. However, I believe this is to gauge whether the person has any manic episodes, because there's 5 questions listed here. One is, have you had more energy than usual? Do you feel unusually irritable or angry? Do you feel unusually excited, revved up, or high feeling? And do you feel like you need less sleep than usual? So I believe those are more focused on determining whether or not the client could possibly be manic or has had manic episodes in the past. And then the ending of the assessment is says indicate whether any of the symptoms discussed in the mental health assessment affects any of the following. So then we try to get an understanding of how their mental illness has affected them in their lives. So some of the questions would be like, it interferes with working or school. It affects my relationship with friends and family. It has led me to use alcohol. It's led me to use drugs. So then once we take all these questions, we enter it into our computer system that gives us a score on the client, determines whether they are considered high risk, medium risk, low risk, and that kind of alters the way that we communicate with our clients and how frequently we reach out to them. So just concluding, I think assessments is extremely important in social work. I'm sure a lot of you are working with assessments. The type that I'm doing, I find it like extremely helpful when I work with these clients after I've completed their intakes and they've discharged. So that's it. Thank you.